Now, your health, your safety. This is ABC7 News.
I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your questions every day at 3 o'clock to get answers in real time. Today, we have special correspondent Dr. Alok Patel. Ask your questions now on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. But first, we want to begin with the 50th anniversary of Earth Day, which is today. It's one like we've never seen before, for a lot of reasons. Joining us to talk about the short and long-term impacts of COVID-19 on the planet is San Jose State University climate scientist Professor Eugene Cordero. Professor Cordero, how are you? Thanks for joining us.
I'm doing well. Thanks for having me.
Before we get into this conversation, I just want to, for the young people out there, younger than us, what is the origin of Earth Day? I saw pictures of former President Richard Nixon actually celebrating it by planting that tree on the White House lawn and then creating the EPA shortly after. It's been 50 years. How did it start, and have things gotten better or worse?
So it's been a good 50 years when you look at it in general. I mean, imagine that more than 50 years ago, we had rivers that were like turning into fire, and that we had really bad air quality in many places. So Earth Day originated with the idea that we got to pay attention to this planet of ours, and we need to do something to ensure that for younger people and for future generations, they have the same benefits as we do. And so today, in general, air quality is better. Water quality is much, much better. And we've done a lot in these 50 years, and yet we still have a long way to go as well.
All right, well, let's talk about things having gotten better. We saw dramatic video of the water in the Venice canals getting a lot clearer. We see a jellyfish going by. We see a reduction of pollution over New York City, over Beijing. Talk about how the shelter in place has dramatically improved the air quality and pollution levels everywhere and here in the Bay Area.
Yeah, I mean, here at San Jose State, where we have a weather station and air pollution station on the roof of one of our buildings, our science building, we've seen dramatic reductions in the amount of aerosols or pollutants in the atmosphere. Typically, they go up during the traffic times, and we've seen a complete flattening of that as a result of us not driving our cars and then some factories slowing down. So here in the Bay Area, throughout the country and the world, we've seen the air quality improve a lot. And that's a great thing, although, to be honest, this is not the way we want to achieve those kind of outcomes.
I was going to say, are you surprised at all by how quickly we saw this change and how dramatically it happened? Because, it takes a long time for humans to change habits. I mean, obviously, this pandemic kind of, forced things, but just the fact that we saw results so quickly, what does that mean?
It was surprising because, the first images we saw came out of China, which had really, really poor air quality in the urban areas. And NASA has a satellite that looks at urban areas and air pollution. And we saw, before and after, just over 2 or 3 weeks. We do know that air pollutants, they go away pretty quickly, like if it rains or if there's strong wind. But just to see the systemic change over big urban areas and that improvement, was super interesting, a welcome sight, and some encouragement that actually, if we really wanted to do something about air quality and about pollution, that we could do something about it.
That is kind of empowering, right? A lot of us didn't believe one person can make a difference, but we're seeing the difference when a lot of one persons begin to take different action. Okay, you see some parallels between the coronavirus pandemic and the climate crisis. What are they?
Well, I'm a scientist and I study data a lot. And this is a very similar type of issue as to climate change, in that there's some data, things are happening. There's scientists who are studying it and trying to predict what's happening today and what's going to happen in the future. I've spent a lot of my career thinking about climate, but I was able to, and we were all able to witness early signs of a coronavirus in another country, and then scientists starting to make projections. Policymakers at first saying, no, it's not really happening or it's not important, and then starting to see, oh, yes, it is. And now, we're seeing policymakers and government embracing what science is saying and using that to make informed decisions. And if, for example, every day you see Gavin Newsom and you hear him talking about science and data and how important it is to have good testing, good data, so we can make good decisions. And it's the same parallel thing in terms of climate, is that we understand the science, we have a lot of data, now we just need to translate that into making good decisions for our future.
Arguably, it takes more cooperation, though, between nations, right, to affect change in the positive direction for climate change, because it seems like each country, even each county, as we've seen here in the Bay Area, can take certain actions to kind of not control fully, but certainly influence how the pandemic takes over in that area. But with climate change, you're talking about pollution wafting across the ocean. Really, you know, one nation's actions alone can't change anything.
Yeah, and that's a great point you raise, is that, you know, with the coronavirus, we could shut down the borders of California or United States and insulate ourselves. We can't do that in terms of climate. But what we are seeing is that we're seeing scientists who are studying the coronavirus share data and information all over the world. And we learned a lot from China and from Italy and from Taiwan and South Korea about what to do and how to respond. And because scientists have been sharing that data in a reasonable way, we in our country can make informed decisions. And it's the same idea in terms of climate. Is we do have to cooperate. And it's fun being a scientist and feeling comfortable cooperating and sharing data with other colleagues around the world. And we're seeing that happen in this for coronavirus. And we've been doing much of that collaboration in terms of climate for many years.
I'm wondering what scientists think about whether COVID-19, the very existence of it, is somehow tied to climate change, right? Because I've been reading, by altering our environment, scientists say humans have really created kind of a wealth of opportunities for viruses to evolve. Is that true?
Certainly some types of diseases, we call vector-borne diseases, or those coming from mosquitoes, for example, we're starting to see those increase as the climate changes. For this particular virus, you know, there is a climate angle with that too, in terms of, you know, we're hoping as the temperatures get warmer in the summer, we might see a decline in the occurrence of this virus. And there really is that type of link. We're not sure directly to coronavirus, but in general, some type of infectious diseases, we'll see an increase in those as the climate continues to warm.
But what are the other effects of warmer climate and the reason we are all working hard to put a pause on climate change?
Well, you know, I mean, we're looking outside today and we're seeing air pollution much cleaner. I was just looking at the Air District's webpage. We're all good across the Bay Area. And we'd like to see that more and more, because we know that air pollutants can damage our lungs, cause asthma. And as well, we've seen in California, we've been kind of at the forefront of issues related to drought, issues related to fires, and severe weather that happens throughout the country and the world. And that's costing us real money.
And lives.
And so,
we've certainly seen our share of that in California, right?
We certainly have, yeah.
We have
so
about
for me,
Go ahead.
So for me, I was going to just say that, you know, one thing that we've also learned is that education plays a key role. If you think about how we learned about the coronavirus and how we're responding to it, we're becoming educated about the science, about testing, and about how to use that science to make good informed decisions. We need to use those same applications in terms of the climate issue, so that we can ensure a safe and healthy climate for everyone in the future.
We have about 30 seconds, but I want to get your take on this, and it's a bit of a guess, I suppose. This whole experience with the pandemic and shelter in place, when it's over, do you think we'll continue to live in a way that's more sustainable, or do you think the pressure to perhaps recover in terms of the economy actually, you know, pressure industries to ramp up more and therefore negate our chances for a cleaner future?
I tend to be an optimist. I think that, and today, especially for being Earth Day, I think that some of us are discovering alternate ways to work, alternate ways to interact, and also seeing the value of what we can do to make the planet cleaner and healthier. And I hope we can take some of those learnings and apply them. We want our economy to thrive. We want everyone to have jobs, but I think we can do it in a more sustainable way, where we can also preserve nature in the way that it was intended for us and for future generations.
All right, Professor Eugene Cordero of San Jose State. I, too, am an optimist, so let's hope we are right about that. Certainly lessons to take away. Thank you so much for joining us.
Thank you.
All right, we're going to take a short break on the air here, but the show always continues online. You know the drill now. Up next, Dr. Alok Patel is going to join us. So go to abc7news.com, YouTube Live, or on our Facebook live stream to post your question and continue the conversation. All right. Hey, actually, we have time for one more question. You still with me, Eugene?
Yeah, I'm here.
All right. What I want to ask you is, what are some easy things that we can each do on a daily basis that adds up to a lot over time in terms of our carbon footprint?
I would say the easiest thing for the average person to do that really significantly reduces one's carbon footprint is to eat less red meat.
Oh.
We get to choose the foods that we eat 3 times a day. And I've become known as Dr. Burrito at San Jose State because I investigate the carbon footprints of different types of burritos. And I discovered that a beef burrito had like 5 times larger carbon footprint than a chicken or veggie burrito. And so when I go to my favorite taqueria, I choose a vegetarian burrito because I know that's like driving a hybrid vehicle instead of driving like a Hummer. And it really does make a big difference. And since we can make those choices 3 times a day, reducing our consumption of red meat really can make a big difference.
Okay, wow, who knew, right? Just in the little choices such as a burrito. Okay, I actually just had a very good avocado, beans, and rice burrito. So yes, I can certainly choose that. Maybe not every time. Once in a while, I get my beef burrito. But like you said, it all adds up. It's cumulative. Don't beat yourself up over one choice, but it's all those little choices we make daily.
That's right. Good job. That sounds like a nice burrito. Okay.
All right, thanks again. I really appreciate it. Bye.
All right, bye-bye.
All right, we're going to shift gears and talk about the medical aspects of COVID-19 and also answer some of your questions when we come back on with Dr. Alok Patel. And that's next.
8, 7, 6, 5, 4, 3.
Welcome back. Let's get some of your questions answered and talk to our special correspondent that you see daily here in a segment we call Doctor's Note. Dr. Alok Patel is part of our coronavirus team of experts, and he joins us live right now. Dr. Patel, good to see you again.
Good to virtually see you as well.
And are we going with the namaste greeting today, or are we going with a fist bump, or are we going with the kind of Chinese Kung Fu martial style, wrists held together? What do you think?
Oh, I'll always go with the Kung Fu martial
the Kung Fu,
arts.
okay.
Always.
However you do it, the
Personal
point is
passion.
the same. Yes, we're being responsible while still greeting each other. Let's get started with this because Governor Newsom held that news briefing at lunchtime today. If people were antsy, wondering when's he going to announce a date for reopening and hoping for that when they tuned in, they'd be disappointed because he didn't give us a date, Alok, but he did say that California has made progress on the 6 indicators. Talk about the most significant progress.
And I will say I understand why people are getting very antsy. People want to get back to work, want to get their normal lives back. If you look at the models, which models a lot of variables and they could change, the model suggests California could start to reopen as early as the 2nd week of May, and I respect the fact that Governor Newsom is instead looking at the different metrics we need to reopen safely. And so California is seeing a slight slowing of cases, but that doesn't mean we're completely out of the woods. There's still hospitalizations, deaths, and ICU admissions. They may be slightly down, but they're still happening. Now, what Governor Newsom was really mentioning, before we really pin down a date, we have to be able to have widespread testing and contact tracing, which I'm happy to go into more detail about that later, but contact tracing has to be in place. Our hospitals have to be at a safe capacity. We have to be able to take care of those people who are at higher risk. And even when we reopen, and this is something he stressed as well, there's still gonna have to be plans for physical distancing in businesses, restaurants, schools, universities, everywhere. So this all needs to be taken into account to make sure that we don't go backwards and get rebound transmission. He even brought that up as well. There has to be a plan in place to be able to switch backwards and go back to quarantining if we have to. And so I think once we make those metrics and we see that we're going in the right track and we see a decline in all coronavirus cases, they may be closer to being able to say when we can reopen, and it's probably going to be a staggered reopening. It's not going to be just lift all restrictions.
Yeah, and staggered reopening also in terms of the states. I think we have a map that we pulled up, and it's one of the new models from the Institute for Health Metrics and Evaluation. Actually shows the estimated reopening dates. It's got California in green there, and it's between May 11th and 17th is what they're saying for us. And then, you know, the mustard color ones, those are the latest to be able to reopen, like Florida, like not until after June 8th. But I want to caution, isn't this all based on our behavior? And if our behavior changes, all this could be pushed back a lot further?
Absolutely. And I think that's a really important point to stress, is that this is all based on how everybody's doing with respect to physical distancing and following all the guidelines we've already set in place. And this is why there's so much national conversation right now on states that want to open up earlier than what's going to be safe. Because if we can't effectively test everybody, we won't know who is still contagious and going back out to bars, restaurants, movie theaters, barbershops, etc. And so some places, I'm not saying California, but some places are at a risk for getting a second, possibly third wave of infections if they open up too soon.
Yeah,
and so
and
you know, one thing that we have to make sure is available is...
Oh,
Go
no,
ahead.
sorry. I didn't mean to cut you off. I was very fascinated by what you were saying
I
about
could
this.
ramble for hours, you know that.
No, me too. Me too. It's like we're an old married couple. Okay, no, you. No, actually, what I want to say is that you talked about the second wave, which we're hearing a lot in the past day as well. And they're saying in the winter it could be worse with the flu season as well. Can you talk about that double whammy which may be coming our way?
Well, the double whammy is something we have to be prepared for. Now, the coronavirus surge here kind of happened at the tail end of flu season. We still have concurrent flu cases with this, but what the director of the CDC and people are worried about is if we loosen up too soon and we then have a huge second wave that goes right into flu season, we could see a disastrous consequence. I mean, right now, we don't have 100% vaccination rate with influenza. And you know, a lot of the issues we're seeing right now, we're gonna see again. We're gonna see hospitals hitting max capacity. There's still gonna be the question about PPE. We have to make sure testing's in place. So we don't wanna see the same kind of barriers right now in getting a grip on coronavirus happen when we're dealing with coronavirus and influenza. I mean, influenza annually, we've said this before, can hit 50 to 60,000 deaths. So we would not wanna see both of these running rampant. That's why this has to be systematic in how we reopen.
Okay, Dr. Patel, we're going to take a short break on the air, but let's continue this conversation over on our live stream platforms, including our app. So we'll be right back.
We are in commercial break for 2 minutes.
All right. So Dr. Patel, God, I bounce back and forth between that and Alok because obviously we're good friends now. We've been hanging out for a few months, but then that's super casual. I feel like on air I should still call you Dr. Patel. We should ask our Facebook viewers what they think.
You can call me Chief, Buddy,
Chief, yeah.
Hype Man, whatever you want.
Okay, all right. The real question is, what does your wife call you?
I mean,
you're
I
in
don't know if
trouble.
your viewers are allowed to call me Brown Bear the same way she does, but
Yeah.
if you want to, that's fine.
Okay. My husband calls me, are you still talking? Okay, so I just hear that a lot. Okay, I want to get to some of our viewer questions, and then we'll continue with that when we're on air, too. Somebody asked, are we at the peak? And, you know, the model that we showed with that map seemed to suggest a early May peak for California. What is your sense for that?
That's exactly right. So my sense is we're kind of heading towards that peak. And I just want to caution everyone is it's really hard to kind of predict when the peak will happen because we are potentially going to see more cases. And if people start going out too soon, we could actually change when that peak occurs. So when you look at these models, again, going back to what we have said many, many times, these models can change. And so fortunately, a lot of states are starting to see either a plateauing or approaching that peak, but we just have to make sure we're really cautious about trying to rest anything on that number.
Okay. I got another question for you. 20 seconds, so we'll hold it for TV. Hang on with her.
15.
With us, our Facebook viewers.
We're back in.
So
the tension.
I know.
8,
I'm losing it because I've been working so hard this week. You?
4, 3.
All right, here we go.
I'm having like back pain from...
All right, we are back with our special correspondent, Dr. Alok Patel, and we want to get to some of your questions now. A viewer on Instagram asked, is it safe to travel by airplane? Dr. Patel?
I would still say that airline travel should be limited to essential travel only. Now, here's one thing that we're going to have to talk about. When states start to reopen at different rates, and people then say like, hey, I want to travel, I need to see my family, go back on this trip I wanted to do, remember, we potentially are vectors for spreading this virus across state lines. And that's something that everyone's going to have to really look at in terms of their own personal responsibility. If we are reopened, that does not necessarily mean that every state around us is safe. We could easily reintroduce another wave of this virus if people start traveling and bringing it back. So I would err with extreme caution when it comes to traveling across state lines right now.
Right, you keep telling us the virus knows no borders, right? It doesn't know when it's crossing state lines either. Okay, Faye is asking, do preschool
Virus
children...
doesn't care.
Yep. Do preschool children and teachers need to wear masks in the classroom for children of essential workers that are still having those classrooms physically?
I would say that teachers should be wearing masks when we start to reopen preschools and daycares, or for the ones that are already open right now that may be having some type of physical distancing. And so again, you know, everyone out could be potentially infectious, contagious. And you think about how many points of contact a preschool teacher or teacher will be making when schools start to reopen. It is going to be important for them to be wearing masks. And here's another thing. Good luck trying to get a group of preschoolers to wear masks themselves. Children are going to touch them, they're going to rip them off, and so it's up to adults to not only teach them good habits, but to protect them. Because if you get a preschooler sick, they may not show symptoms right away, but they are very capable of going home and infecting their parents and infecting everyone else around them.
All right, I think this is a good question from Tess. I'm wondering this myself. Why so much concern about testing, and why not concentrate on developing medication to prevent the virus, or I suppose to treat people? So she's talking about maybe a vaccine and treatment.
And was it Tess? Because that's a great question, Tess. And actually, you know, as outlined by Governor Newsom and a lot of other people looking at reopening, and if you looked at that roadmap to reopening, they both need to be done. Because, you know, therapeutics are, for now, are going to be done in the hospital setting in terms of treating people who already have symptoms. A vaccine is going to be the Hail Mary that'll be able to get us herd immunity to protect everyone. But, you know, we keep saying we're about a year and a half away from a vaccine. That's not a guarantee. And so in order to kind of isolate and identify who currently is contagious, who is at risk, that's where the testing really needs to come into play, and why I appreciate the fact that San Francisco is now going to try to push for widespread testing for anyone who may have symptoms. And, you know, one other point this is going to lead into is contact tracing. So contact tracing is crucial when it comes to controlling the spread and when we reopen the economy. With testing and with, you know, really active surveillance, we're going to be able to identify anyone who's sick, but then also identify everyone they've been in contact with and they may have exposed. And that's the best way to kind of get a grip on and trace all the positive cases and prevent it from spreading even further.
Rhonda is asking, I don't understand the numbers. If we have over 3 million people, and I wonder if she means 350 million or, you know, something like that, our population, and have only done 4 million tests, how do we get real numbers, know the real infection rates?
Very insightful, Rhonda. And we're frustrated and asking the same question. We keep hearing on the news that we've done over 3 million tests. And, you know, we have millions and millions of tests, but we have over 300 million people in this country. So per capita, we're not doing enough tests. And we've seen per capita, so per person, other countries such as Germany and South Korea have done a lot more tests. And so even if we're doing 100,000 to 200,000 tests per day, some estimates are saying that that number needs to be kicked up to millions per day. So we can sincerely be able to tell how many people actually have this. We can't have any backlogs going forward when it comes to testing. If you think about how quickly you can get a test for everything from the flu to other colds, even an at-home pregnancy test, we have a much higher capability to do all of these than we currently do with coronavirus, and that needs to change.
It does. Okay, we have time for a few more questions for Dr. Alok Patel on our live streams. That conversation continues right now. Short break on the air. Okay, I'm going to sneak in one of my questions here, Alok, which is, you know how today we're really focusing on those 2 deaths in Santa Clara County? Now that we know they were in February and they were COVID-19, and those were before the alleged first case that we all thought in Washington State in March. So it's been around here longer than we thought. So what are the implications of that?
Well, the implication is that, if we had a death 3 weeks earlier than the one reported in Washington, it's possible and probable that we had community spread of this virus before we thought we did. And this just kind of really underscores the fact that these viral infections are really hard to trace, and we have to just kind of be on top of it. So the cases from the preliminary reporting I heard were not linked to any travel. And so that tells you that somebody in the community had been spreading around far before we even thought it did. And this was in Santa Clara County, which is not Washington State, which is where the first death was originally reported. So this is 2 states away from it. And, is it possible this happened somewhere else in New York City? It is possible. And so, this just really speaks to the fact that we need to pay a lot of attention to how the virus spreads, community spread, and we did act late. And that's something that we are now recognizing.
Okay, when we come back on air, Mr. Director, Producer, how much time do we have when we come back?
3 minutes to wrap it up with Dr. Patel.
Oh, we have 3 minutes? Okay. Then let's get back.
3 minutes.
Let's get ready to go back on air. Woohoo. I want to talk about, the return of surgery, like elective surgery or important life-saving surgery, because Governor Newsom talked about that today. Cool? Okay.
10, 9, 8, 7, 6, 5 seconds, 4, 3.
All right, we are back with our special correspondent, Dr. Alok Patel. Dr. Patel, today Governor Newsom talked about how the state is now finally able to allow for the resumption of some surgeries. Can you talk about how important that is and why now? I mean, he made a point that these would be life-saving, very important surgeries that people have been putting off.
This speaks to the fact that when you hit a max hospital capacity due to something like coronavirus, everything else gets pushed backwards. Everything that's an elective surgery or preventative health, even routine checkups. And that also has its own downstream health consequences. And one way to be able to say we can effectively get back to doing elective procedures is to know that our hospitals are in a safe place, not only from staff and faculty wise, but also with PPE and supplies. Every time an elective surgery is done, that's a valuable PPE that's being used. And that's part of the reason why so many of those have been pushed off. But like Governor Newsom mentioned, is that these are surgeries that people in a lot of cases actually need. And it's not safe to keep people away from hospitals. I have colleagues in so many different fields, from cardiology to GI stomach doctors to neurologists, who are talking about how patients aren't coming in and they aren't getting the treatment they may need. They're not getting the preventative care because they're afraid of going into hospitals right now and getting infected. Or they also think that they want to do the responsible thing and stay away. And so preventative care and making sure that we're taking care of everybody else is also really important. We can't have people, not being able to get health care they need if it's not coronavirus related because of the times we're living in.
Okay, I want to touch on the Stanford antibody study that's gotten a lot of attention and controversy in the past couple of days. That one seems to suggest that the actual number of infections could be 50 times greater than what we have confirmed. And if that's the case, and you take that bigger number divided by the number of actual deaths, it seems to be suggesting that COVID-19 actually has a much lower fatality rate. What do doctors think about that? True, not true?
Mixed opinion, because it's a preliminary study. So you're speaking to the antibody survey that was done in Stanford, and there was also another one done at USC. And you're correct. What they looked at is they looked at a smaller sample of people, and they tried to make it representative of the entire city. In USC, for example, about 800 people, and they found that 4% of that group had this antibody test coming out positive. So if you were to extrapolate that data, that tells us that, hey, we might have 50 times more people who have been exposed to this virus. And, perhaps the rates are a lot lower. Now, there's a couple caveats. First thing is that, again, it's a small amount of people that you're trying to make a large assumption with. Also, there are chances for false positives with those antibody tests. But now let's just say hypothetically, that we really do have a lot more people, and up to 4% of people have been exposed
I'm
to this.
sorry, Dr.
4%
Patel,
is very far from 60%.
We need to continue or finish this conversation online because we're out of time on air. But thank you so much for your insight as always. And thank you, folks, for joining us on this new interactive show, Getting Answers. Back here tomorrow at 3.
Thank you.
Ooh, I left a few seconds on the table. But thanks for joining us. World News Tonight is coming up next. Have a great day.